A 73-year-old Chinese woman has died after being infected with a deadly strain of bird flu not previously found in humans. This marks the second new bird flu strain to emerge this year. Here with us is Arise medical contributor, Dr. Aletha Maybank, to explain what is going on here.
Yes.
Hey, it's good to see you.
Good to see you as well.
This is very serious and it's very concerning. Tell us a little bit about this case, first of all.
Right, so this is a 73-year-old woman who actually presented to the hospital in China back in November, late November, with symptoms of severe pneumonia, heart problems, as well as high blood pressure, and basically died around December 6th. And so they finally came back with the test results and found that there's this new strain of bird flu that she died from, H10N8. Another, kind of the alphabet soup of how we label flu. But this is the first time that they've seen this in humans. It typically is in a bird, and she has had the history of being around poultry, which makes sense with how a human possibly could get a bird flu. The good thing about this particular case so far, never good somebody passes away from flu. However, it is one case. We have not seen any other cases yet. And they suspect there to be a low probability that we will see other cases potentially with this. But they are going to keep an eye out, because whenever you start to see humans develop or get bird flus, it's concerning because, one, they can spread rapidly, and two, they can mutate and change pretty quickly. And that's the nature of flu viruses in general. I think, as we watch the news and you hear about these new strains and you hear about all these different types of flus and it gets a little confusing, I think the important thing to recognize is that we are vulnerable to transmitting and passing back and forth to the things and the people and the animals that we're next to, and that they change and it can happen pretty fast and they can be pretty deadly. And so when we do have the opportunity to have precautions to protect ourselves, to really utilize them, because it can be pretty serious.
Yeah, absolutely. Can you, and this would be speculation, but Aletha, can you speculate sort of why, particularly this, these bird flus are evolving enough to be contagious in human beings? Because usually there is not species to species transmission.
Typically not, but what happens is that, and we see this more and more, because as we become more integrated, or less integrated in some places, but in a place like China where there's a lot of interaction with humans and animals, and it may not be particularly clean or it may not be particularly sanitary, there's a lot of things that can happen back and forth. It's the same thing with H1N1, the same kind of from swine to person to bird as well. And so a lot of it has to do with how we're interacting with animals, what are we doing to sanitize ourselves in the situation, or lack thereof.
All right, and this is just something at this point to monitor, certainly
Absolutely.
Not to be alarmed or cause panic about.
Not yet, but the World Health Organization definitely has their eyes open, as well as most health departments and centers of disease control from all across the country and the world also have their eyes on this particular strain as well.
Okay, I know you're going to keep us updated on
Absolutely.
that. All right, let's move on and talk about this a study that shows a link between schizophrenia and marijuana.
Right. So schizophrenia, and we've heard the term a lot, and people are, usually are confused by it. But it is, what it is. It's a very disabling mental health disorder in which people can get hallucinations. They can hear people talking to them sometimes that really are not there, and they can see things. Marijuana, as we know, is one of the most widely used illicit drugs here in this country among young people. This particular study actually looked at those who were 20 years old at the time of the study, but they looked back when they were 16 or 17. So they did marijuana for about 3 years. They looked at those who had schizophrenia and those who did not have schizophrenia, those who used marijuana and those who did not. And basically what they found are those who had heavy use of marijuana actually had a particular damage to the particular part of their brain, the thalamus part of your brain, which is important for memory, concentration, and learning. And actually our working memory, so our ability to kind of process information at a particular time. And what they showed is that those who had heavy marijuana use and those who also had heavy marijuana use and schizophrenia had similar brain changes. And that those who had schizophrenia actually had almost 90% use of marijuana prior to them getting schizophrenia.
Wow.
And so I think what this particular study shows are a couple things. And there's a lot of conversation now about marijuana in the news and it becoming legalized. And there are medical benefits. We're seeing the research related to that, but then we're also seeing this other, wealth of literature to show that this is really about heavy use and abuse. There is a particular medicinal purpose for marijuana that I think the research is definitely supporting. But when we look at heavy use, we got to look more seriously, and especially with young people with their developing brain. It is very different with a developing developing brain than it is an adult brain. And many young people, we have a new study that's out, demonstrates and shows that young people do not see marijuana as being serious at all.
And that
so
hasn't changed over the years.
It hasn't changed over the years, for the most part, but we are seeing an increased use among seniors, way increased use, as well as now we're seeing it among younger kids, even 8th graders, to the point of where we haven't seen to the levels before. And being open about it as well. I'm sure there's a piece of that too, where, we weren't as open about speaking about using drugs if we did use drugs, at that particular age back in the day as compared to kids now.
Yeah. Well, this is some ammunition for parents as they talk to their kids about the use of marijuana.
Absolutely.
Before we run out of time, we only have a minute left.
Sure.
Tell us what you've learned about fibromyalgia.
So fibromyalgia affects 1 in 5 Americans, mainly women. Basically, it's a condition in which you feel pain in your muscles and your bones. Historically, many times women were almost brushed off as saying it was something emotional. This really wasn't a physical problem. But what's happened this year in 2013, there's been a wealth of information coming forward and evidence showing that there is actually something physical to the body and that it's actually possibly affecting the nerves and tiny nerves over all parts of the bodies, not the blood vessels as well as organs. So this is the first time that actually there's some support for women and people who have fibromyalgia, to say that it's not just an emotional issue, that this is actually something that potentially we could get more drugs, more treatment for to help these individuals out instead of just treating them with antidepressants or medicines just like that.
Yeah, that's got to be welcome news for them because
Absolutely.
Yeah, when you can find these physical manifestations, that's a way then to find a way to treat it.
Absolutely, and it becomes less frustrating for the women. And I think that there's such an emotional toll that plays in with a disease such as fibromyalgia.
Yeah, indeed. All right, Dr. Aletha Maybank, thank you. Always good information.
Thank you.
See you next week.
Okay.
And you're watching Arise America.